If you're a Christian woman struggling with anxiety and depression and you have a history of childhood trauma and you're under a lot of chronic stress, here is one of the main things you can do to help your body back into a resilient state. Gain an understanding as to whether you are a person who is hyper-aroused, meaning that you struggle with more of anxiety, hypervigilance, feeling on edge, irritability, or if you're someone who struggles more with a chronic depression and fatigue, you struggle to get out of bed in the morning, you struggle to have energy overall. The reason you want to start here is because your primary default survival response is going to have a downstream effect on the rest of your organs in your body and is going to give you a starting place as to the type of support that you need. For example, for me in my unique body, I tend to default to more of a collapsed state. If I have a lot of anxiety going on, I will default into freeze. And because of this, I am prone to episodes of low blood sugar, which is caused by a depletion of certain nutrients like vitamin B, for example, potassium, magnesium. And it also puts me at risk for a low cortisol awakening response, which used to make me very fatigued in the morning. When you are in a collapsed state for too long, it starts to suppress something called your hypoadrenal axis, which has an impact on all of these organs here. If you go into talk therapy and trauma therapy without knowing your default response and then not becoming aware of the nutrients that you need, you're going to keep cycling because your body doesn't have enough resources to actually deal with what you're bringing up. Because you can't just talk your way out of trauma or chronic stress, you actually have to have the resources to deal with it. It's not a guessing game, and you don't want to just ask someone else what your default response is. You want to actually tune in and map it out, because it not only gives you a sense of agency and independence, but it also empowers you to take action. I teach you exactly how to do that inside my Aligned and Renewed course. You learn all about your nervous system, how to map it out, and then how to create a menu of your unique needs.